Hey everyone, today I want to talk about a really interesting topic, and that's the issue of nasal breathing after a surgery. In particular, when it goes wrong and breathing is either not corrected or worsened after a nasal surgery. The two nasal surgeries I want to talk about, obviously rhinoplasty surgery, but also something called septoplasty. This is a surgery that is performed to improve breathing. It's referring to correcting the nasal septum, which is the wall between the right and left sides of your nose. Sometimes it's deviated to one side and blocks the breathing, and it can be corrected surgically. Today I want to talk about what happens when you have a breathing problem and you undergo a surgery and it fails. Or, in a worst case scenario, you actually have worsened breathing afterwards. So the first scenario I want to talk about is a septoplasty. This is actually a really common thing. People have deviated septums all the time, and septoplasty is a very successful surgery in the majority of cases. But there's a handful of patients who undergo septoplasty, and it just didn't help very much. And the question is why? So in my experience, I've seen a couple things. One, I think it points to the fact that the septum was probably not the breathing issue to begin with, and therefore correcting it didn't make a huge change or enough of a change to have the patient say, oh, you know what, that's better. So it brings up the idea that there's something else in the nose that regulates nasal breathing, and it's called the nasal valve. The nasal valve is broken up into two components, the internal nasal valve and the external nasal valve. But you can kind of think of it as just one unit. It's the front of your nose that regulates how much airflow goes in. If it's collapsible or if it's bulky or weak, these are all reasons that the airflow will be stopped before it even really enters the nose, and you will feel it as obstruction. So if the septoplasty failed to correct a breathing problem, it's important for the surgeon to assess for nasal valve problems and then have that discussion with you. After a rhinoplasty, the nasal valve issue can actually be affected by the surgery itself. A lot of the nasal valve is actually the tip of the nose, and many of the maneuvers that are used to narrow or sculpt the tip of the nose can actually reduce the function of the nasal valve and block breathing, and this is a horrible outcome. In fact, a lot of the field has developed techniques that are known as structural rhinoplasty techniques. The whole idea and philosophy behind this school of thought in rhinoplasty is to preserve the structure of the nose, and in particular the nasal valves. Because to sacrifice this and to get an aesthetic result for many surgeons is just not something that we feel is appropriate. It's something we try to avoid at all costs. So if you've had a rhinoplasty and developed a new difficulty breathing, again, it points to the nasal valve. And this is where you have to consider that the treatment is actually a reconstruction of the nasal valve itself. So, if you think any of this applies to you, you're having some breathing issues after a nasal surgery, it's probably a good idea to get a very thorough evaluation, have somebody check it out, and make sure that they understand the anatomy of the nose and what could be causing it. So, if any of this speaks to you and you want to set up a consultation, give us a call, send us an email. We'd love to meet with you.